Good morning, everyone, and welcome to Virtual Community Project 3.0 Day 3. I'm Amalin Disanaika, and I'll be one of your moderators today. The event will start shortly in about 5 to 10 minutes. In the meantime, please do share the link to all your friends and family members. Thank you and see you soon. Hello and good morning to all our attendees today. I am Amalini Disanaike, your moderator today, and we warmly welcome you to VCP 3.0 Day 3.
Hi, with me today, Ainul Humaira Ibhas, a virtual community project was planned by Dental Public Health Department of MAHSA Dental Faculty. This project aimed to enlighten the community and increase the awareness on oral health care, and to be more specific for today, we're going to discuss in details on the sports injuries and avulsions, oral care for special needs, and dental erosions. For each of the topics I mentioned just now, there will be a Q&A sessions. Therefore, please utilize the privilege to at least clear up your doubts. Our doctors will try their best in addressing the questions. Oh, before I forget, sorry. At the end of this program, there will be a link provided at the comments. Do join the quiz, and I'm pretty sure you will be happy to have a set of oral kits as a token of appreciations. Note that this e-voucher only can be redeemed whenever you give a visit to us, Dental Clinic at MAHSA University.
Before we begin today's agenda, I would like to first focus your attention to a short clip on MAHSA University. Our first presentation today is on the topic of sports injuries and avulsion. Many of us here today would have at least had one sports injury in our lifetime. We'll be looking at the causes, types, and also the treatment of sports injuries and avulsion. So sit back, relax, and enjoy the following presentation.
Orofacial sports injuries.
Let us start. What is a dental injury? So dental injuries usually occur in the contact and non-contact sports, as well as during recreational activities. Sports-related dental injuries in children and adolescents are predictable based on analysis of a specific set of causal factors. This basically means that there are several causal factors that result in these dental injuries, such as boxing, martial arts, football, hockey, rugby, and many other types of sport activities.
So first up, we have accidental direct impact. Almost all kind of sports can cause injury accidentally. These might be due to athlete's factor, carelessness during playing, equipment, or the environmental factor. Equipment, in the sense that maybe the equipment is not in a good condition for the player to safely use them, and this also applicable for the environmental factors such as the court, the venue whereby the player are playing. Moving on to the next causes, which is there's no regulations on use of mouth guards. Mouth guards are one of the form of protection from dental sports injuries. However, absence of rules obliging all athletes to wear it causes more players to experience injuries.
Next up, we'll talk about types of sports injuries with a higher risk. So the most common sports which have a higher risk of injury are known as contact sports. Now, contact sports, unlike non-contact sports, have a very physical nature, and that's what leads to the dental injury, right? So starting off, we have American football, which is rugby. We have soccer. We have kickboxing, taekwondo, and hockey. So as you can see, all the sports that I just mentioned are quite physical in nature, and that's what leads to the dental injury.
Effect on oral health and complications.
My topic for today is sports injuries. Effect on oral health and complication. First, I'm going to discuss on effect on oral health. There are three types, which is soft tissue, jaw fractures, and dental trauma. On soft tissues, we have bruises, cuts, and laceration to the lips, cheeks, gums, or tongue. We have contusions are the common injury. They are usually the result of blunt trauma to the face. Abrasions are disruption of the epidermis as a result of sudden forcible friction. The third one is dental trauma. Based on the picture, the first one is concussion. Concussion occurs when the periodontal ligaments that holds a tooth in place are damaged, which leads to discoloration. The second one is subluxation. Subluxation is when the tooth is mobile, not displaced, and has bleeding around the gums. Extrusion is partial displacement of the tooth. Luxation is displacement of the tooth. Infarction is microcracks. Enamel fracture, dentin fracture, enamel dentil pulp fracture is the part that where the tooth is fractured.
Oral and facial injuries are very common in sport and can be very expensive to treat. Many of these injuries are preventable with the proper pre-competition assessment and suitable well-designed protections. So today, I am Ainul Humaira, who will be kindly present to you some of the treatments for the oral and facial sport injuries. The treatment for the oral and facial spot injuries are subdivided into four main components. The most important part is the preventions, where the athlete itself have to take this at the first place. And then we have non-surgical treatment, surgical treatment, and also physiotherapy and rehabilitations for the long-term run. A general talking, anything to do with the teeth, from creasing or simple chipping to the complex fractures, or maybe avulsions, where the tooth removed from its sockets. More serious conditions occur when the teeth are fractured, a term that refers to a break in the outer protective layer of the tooth, the enamels and dentine. This is where, if the fracture is serious enough to expose the tooth inner pulp, immediate attention from a dentist will be needed to reduce the risk of losing of the tooth by treating the exposed pulp and nerve tissues. Take-home message is that the main goal is to the salvage of the affected teeth whenever possible, to maintain health, function, aesthetics, and avoid the tooth loss.
Okay, so now I'm going to explain about mouthguard. Okay, the definition of mouthguard is a soft plastic or laminate device that is used in sport to prevent oral injuries to the teeth, mouth, cheeks, tongue, and jaw. The types of dental injury that can occur without the use of a mouthguard are chipped or broken teeth, fractured crown or bridgework, lip and cheek injuries, root damage to the teeth, fractured jaw, and concussion. Any athlete may be at risk for oral injury, and any injury can be prevented with the use of mouthguard. Mouthguard are mandatory in collision sports such as football, hockey, and boxing, where the risk of injury is likely. Children and adults involved in incidental contact sports like basketball, baseball, softball, wrestling, soccer, and volleyball may consider wearing a mouthguard to prevent injuries to the mouth. Initially existed for the sake of boxing sport. Okay, now is the feature of the mouthguard. So, mouthguard should be properly fit into the mouth of the user, and then it should be comfortable yet tight-fitting. A mouthguard should allows normal breathing, speech, and swallowing. And a mouthguard should not cause gagging or irritation to the wearer. The next one is a mouthguard should be odorless, tasteless, and thick enough with a minimum of 4 mm to provide protection against the impact. The mouthguard were made of the following material: polyvinyl ethylene, copolymer clear thermoplastic, polyurethane, and laminated thermoplastic. Okay, so now moving on the mechanism of the mouthguard. Here you can see the diagram, and so the main purpose of mouthguard is to absorb and distribute the forces of impact received while participating in the athletic activities. So these are a few impact that could happen during a sport. So the first one is laceration. So a properly fit mouthguard can help to protect the soft tissues of the lips, cheeks, gums, and tongue by covering the sharp surface of the teeth. And then we have a mouth impact, where can cause possible damage to the soft tissues of the lip, cheeks, tongue, and gum, as well as the teeth and the upper jaw. So by wearing mouthguard can prevent this. The next one is a direct jaw impact, which can cause a possible damage to the teeth, TMJ, and the jaw. Then we have under chin impact. It can cause possible damage to the teeth, TMJ, and jaws. And then it can also cause a jaw fracture. So by wearing this mouthguard, you can prevent all of this. Okay. So about the jaw fracture, a properly fit mouthguard can reduce the force upon impact, helping to protect the jaw from fracture. And then the last one, we have the TMJ jaw point trauma, where a properly fit mouthguards can reduce the potential for jaw joint fracture and displacement by cushioning against the impact.
As we all know, there are 3 types of mouthguard, type 1, type 2, and type 3. Basically, type 1 is stock mouthguard, where people can buy and purchase the mouthguard from the pharmacies. And then type 2, it is mouth form boil and bite type, available commercially but need modification by the dentist. And then better protection and adaptation. It causes less interference compared to type 1, and it is basically made of thermoplastic material. For type 3 mouthguard, it is called as custom fitted, made in a dental practice or dental technician lab on a cast. Best protection and adaptation. It offers least interference with speaking and breathing. Next part will be on the wearing or adaptation of mouthguard type 2. The first instruction will be boil water 185 Fahrenheit to 212 Fahrenheit and let the water stand for 40 seconds. Place mouthguard in cold water for 1 second and then remove the water and place the mouthguard in patient's mouth. Ask the patient to bite and suck water and air out of mouthpiece. Leave in mouth for 10 seconds. And then use fingers to press the mouthguard against the teeth. And if the patient do not get a tight fit of the mouthguard into the teeth, then just repeat the procedure.
Alright, so these are the review of the types of the mouthguard and its advantage and disadvantage. So for stock mouthguard, you can see the advantage is that it is ready stock, it's low in price, available at all sports stores, and then it's the disadvantages: low protection, low comfortability, and not recommended by dentists. And the second one, we have the boil and bite mouthguard, where the advantages are ready stock, available at sports stores, can be adjusted to the user mouth size. But for the disadvantages, it is has a moderate price, and then also has a moderate protection. Okay, and then we have the last one is a custom fit mouthguard. So we can see here the advantages are best protection, best comfortability, and the disadvantages are it is costly and it has to be specially ordered at dental clinic. Okay, so now we are going to look at how to care for mouthguard. Okay, the first one should be the mouthguard should always be rinsed in the soap and warm water after each use, and then allow it to air dry. Okay, then we have disinfecting the mouthguard from time to time using a mouthwash, and keeping the mouthguard in a well-ventilated plastic storage box when not in use. So, however, the box should have like several holes in it to allow the air ventilation. Okay, and then do not leave the mouthguard in a direct sunlight or in a closed car or in a closed box where there will be like exposure towards heat. Okay, because they might alter the shape of it or the composition of the mouthguard. And then make sure your mouthguard is in good condition before every use. Like just check it before you use it and you start to play your sports. Then ask your dentist to inspect your mouthguard at every dental checkup. So every time you went to a dental checkup, just ask for the dentist to have a quick check on your mouthguard. And then do not wear a damaged mouthguard. If it is damaged, go replace it and make a new one. So for a child's mouthguard, it should be replaced every 12 to 18 months, even though it is in a good condition, because there will be a growth and new teeth can alter the fit, or the mouthguard could influence the growth of the child's teeth. Okay, and then for adult mouthguard, it should be replaced after any dental treatment, or if there are any tooth loss, or if there is no problem, it should last for several years. Okay, then wear the mouthguard at all times, including games and training session. I mean, just let it be in your mouth and don't put it in and put it off, because it just can cause a mess. Okay, and then for a player which undergoing a dental treatment can have a custom fit mouthguard made by the dentist to fit comfortably and accurately. This is mostly for sport player which is wearing braces or have like, I don't know, ortho treatment or something. Okay. Okay, so now just some additional notes. Okay, as a sport dentist and health professionals, we highly recommend a custom-made mouth guard, especially those of the laboratory lamination type, for the very best in oral facial protection, as well as concussion deterrence. Okay. This section has presented a discussion of the various issues relating to injury prevention and mouthguard. By acknowledging this significant difference in mouthguards, the public will be better informed and educated to seek their dental spot protection from dental health professionals.
Finally, it is extremely preferable for anyone before wearing a mouth guard to consult their dentist first and have a good discussion on which type of mouth guard that they should get, whether type 1, type 2 or type 3. That's all from me. Thank you.
Tooth avulsion. Avulsion is a dental injury in which the tooth comes out of its socket due to severe trauma. It is commonly seen in children from ages 7 to 9 years, but can also be seen in all ages in both milk teeth and adult teeth. It mainly affects incisors as they are present in the front. The causes of tooth avulsion is due to trauma, such as falls, physical injuries, contact sports, and activities like swimming and cycling. The risk factors are children trying some extreme tricks on a bicycle, or an improperly fitted mouthguard, or a protruded central teeth and insufficient lip closure. There are two ways parents can manage the avulsed tooth. The first is at the site of injury. Push the tooth back immediately if the tooth came out a little bit but didn't fall off. The second is to keep the tooth moist in a transport medium if it falls out, and immediately visit the dentist. This is the emergency management at the site of injury. First, pick the tooth by its crown and not by the root. Second is to check the root surface cleanliness. If it is dirty, rinse the tooth with fresh milk or tap water. Fourth, place the tooth back into its socket and bite on a clean handkerchief to keep the tooth in place. Lastly, immediately go to the nearest dental clinic. Keeping the tooth moist in a transport medium. If it's not possible to replant the tooth at the site of the accident, store the tooth in a suitable medium to be transported to the nearest dental clinic. First, keep the tooth in cold fresh milk or saline, or place it in the buccal sulcus between the cheek and the teeth. Lastly, transport the tooth in the medium to the nearest clinic as soon as possible. What does a dentist do with an avulsed tooth? So the patient comes in with either a replanted tooth or tooth that has been kept in a suitable medium. Then the dentist will clean the area with saline and verify the correct position of the replanted tooth. After that, the tooth will be stabilized in position by splinting it for a week. A follow-up appointment is done after a week. The take-home messages are to take a soft diet for up to 2 weeks, use mouth rinse twice daily, brush the teeth with a soft bristle toothbrush, and avoid biting on the splinted teeth. As for medication, the patient will be given antibiotic, syrup or tablet paracetamol, and 0.12% chlorhexidine gluconate mouthwash. The importance of replantation are to eat, to smile, and to maintain space. There are two things that can happen when a tooth comes out of its socket and is not replaced. Over time, the neighboring teeth will start to move into the vacant space, and not only that, but the bones will begin to shrink. These are the complications of tooth avulsion. The first is bone loss. It begins in the tooth and destroys the surrounding dental hard tissues. The second is a death of blood vessels in the tooth, and this causes the discoloration. The third is the replacement of bone loss. The fourth is the narrowing of blood vessels in the tooth. And the last one is a fusion of tooth structure with bone. Prevention of tooth avulsion.
The first is to wear a customized mouth guard or a helmet to protect the teeth when participating in sports. The second is to wear braces to correct protruded teeth. And the last one is to stop harmful habits such as biting ice cubes, metal objects, and opening tin cans using your teeth. What to do when the tooth is avulsed? First, hold the tooth by the crown and rinse it with clean water. Then try to reinsert it into the socket. If this is not possible, submerge it in milk. Immediately seek help from a dentist after doing all of these procedures. Tooth avulsion do's and don'ts. Do not try to clean the tooth by brushing, but do seek a dentist immediately, as an avulsed tooth should be treated within an hour. Second, place the tooth between the cheek and the gums if milk is not available. Thank you for listening.
Okay, so dental spots injury and avulsions are the most common cases which give visits in the emergency department. Here, please alert to all athletes or even parents with a highly active children. We do have a preventive measurement, which is the mouth guard, and I hope that the first video to help us to understand more how the mouth guard help to protect the athletes, and for the most of the cases for avulsions happen, we can at least try our best to save the tooth for the long life use.
We would now like to welcome Dr. Ko and Dr. Cheng, our panel members for today. Good morning, doctors, and welcome. Before we kick off the question round, I think it would be much appreciated if you could give us a small introduction about yourselves. Shall we start with Dr. Ko?
Hi everyone. Selamat pagi Malaysia. I'm Dr. Kaur. I'm a postgraduate student at MAHSA University and also a private dental practitioner.
And what about you, Dr. Cheng?
Hi everyone, good morning. I'm Dr. Chen. I'm also a postgraduate student from MAHSA University and also a private practitioner.
Then we would now like to start the question round and take any questions you may have. Please type in your inquiries you may have into the chat box. Right, we start with our first FAQ. I would like to address this question to Dr. Cheng. How does dental injury occur when playing sport?
Usually the dental injuries that occurs, it most commonly happens during the contact sports, such as when you're having contact with a ball or when you're having contacts with a person to person. So, or can be due to contact to the equipment that you're using, such as the hockey sticks or any cricket bats. So all this will happen when you have contact, then you have a chance of having the dental injuries.
Overall, most dental injuries involve the upper front teeth. Dr. Ko, what are your thoughts on this statement?
Okay, as mentioned in the question, most of the injuries actually involve the upper front teeth, mainly because it's the location of the tooth, okay, is the most front, and the tooth actually, the injury also, the frequency of injury also depends on the positioning of the teeth. If the teeth is a bit sticking out, as what we always say, it may be more prone to injury. But whatever the position or the situation of the injury, the risk of injury is always there. Okay, so it's better if you have any doubts. Okay, you can always visit a dentist and ask for advice. Yeah.
Okay, thank you very much, Dr. Ko.
Okay, so for the third questions, I would address again Dr. Cheng. How should one care for a mouth guard?
Hi. So as I think just now during the presentation, they also stated that the mouth guard actually is made of thermoplastic. So of course we will need to have a special care for it. So usually what we can do is we clean it by washing it with a soap and warm water only. Not hot water should be used. So before storing, we should soak the mouth guard in a mouthwash and also keep the mouth guard in a very well ventilated plastic storage. So also make sure that the box actually should have a hole so that the mouth can be dry. We need to know that the heat is actually bad for the mouth guard, so we don't leave it in the direct sunlight, and we also don't bend the mouth guard when storing. So other than that, the mouth guard you shouldn't share with some other people. We just don't wear some other people's mouth guard. So it's better to have the own mouth guard.
Thank you, Doctor, for your.
What is the most suitable medium to store a avulsed teeth? Can I direct this question back again to Dr. Cheng?
Hi. So for the most suitable medium to store the avulsed tooth, of course, as we mentioned just now, actually milk is the best is the best solution. If we can't really find a milk, then we can maybe store it in the saline as mentioned, or maybe you can just store it in the butter sheet or our own saliva.
Thank you, Dr. Cheng. Now the questions I would like Dr. Call to help me. My child's tooth fell out. What should I do, if ever?
Okay. Now, first of all, do not panic. Okay, it's very important. Okay, and after we manage to locate the tooth, we should also know which part of the tooth is actually the crown. Okay, the visible part in the mouth, and which part is actually the root of the tooth. Okay, it's important because we can only touch and hold the crown of the tooth and not the root. And if we have to make sure that it's not dirty, okay, and do not try to scrub or clean the tooth by scrubbing. Don't. It's just best to clean it under running water, and we place it in the if it's available, okay, cold milk or any or salt water. Okay, temperature is very important. Okay, not hot, man. And finally, it's best if we cannot reposition the tooth back into the socket. It's best to rush to the nearest dental clinic. The earliest possible is very important because the critical time is about 20 to 30 minutes.
Thank you, Doctor.
What is the time limit that reimplantation of an avulsed tooth can be performed? Dr. Ko, could you give us an answer to this?
Yes. I think I just mentioned it just now. The critical time or the golden time is actually 20 to 30 minutes because the cells on the surface of the tooth, especially the root, it should not be exposed to dryness, okay, without nutrition, and the time is the essence is very important. 20 to 30 minutes as early as possible.
Thank you, Doctor, for addressing our questions. So now I shall proceed to the next video. So next we are going to discuss about the oral healthcare for the special needs. Some real superheroes live in the hearts of a small children fighting the big battles. Quoted from somewhere. Special needs children are God gift to make life more joyful. We as a dentist really appreciate, and here are some of the oral health care tips for the best parent ever. So do stay with us.
Assalamualaikum and hello to everyone. Right now we'll be presenting on special kids and special care. So first of all, why do these special kids need extra special care? We'll find out now in the following presentation. Sit back and enjoy. Well, let's get to know about special needs children. Who are they really? They are children who have disabilities due to physical, mental, or medical problems. These disabilities may include intellectual, developmental, emotional, which could either be psychological or behavior, and also sensory impairments like hearing or vision impairments. According to Person with Disabilities Act of 2008, they are defined as those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society. Some of the medical conditions that may include these children under this category are ADHD, also known as Attention Deficit Hyperactivity Disorder, autism, epilepsy, vision or hearing impairment, cerebral palsy, and Down syndrome. According to UNICEF Malaysia, as of 2019, there are 440,000 out of 9.3 million of total kids in Malaysia who are registered as disabled. But note that there could be more of this number, possibly due to lack of resources or poverty. Caries is a process that involves a balance between the loss of minerals in the tooth and its replacement. For your information, it is very common in special needs children because they are unable to perform oral self-care and also because of the medication taken for their condition. The obvious signs of caries are black spots on teeth and decavitations as seen in the pictures. It occurs as a result from bacterial reaction with sugar derived from diet, which leads to an acid attack reaction. This causes a less aesthetic appearance of the tooth and tooth loss. So next, I will move on to gum disease. Down syndrome children have a high prevalence of experiencing this disease because of some factors related to their condition. This problem arises because of the presence of plaque on the tooth surface as the result of inadequate oral hygiene. The usual symptoms, as you can see here, are red, swollen and bleeding gums, as well as bad breath and loose teeth. Gingivitis is the initial stage of gum disease in which, if it is not treated, it may progress to an advanced stage named as periodontitis. Another condition commonly associated in these children is gingival hyperplasia or gums enlargement. This condition occurs mainly in those who take phenytoin to control their seizure activity. Malocclusion is the poor fit between the upper and lower teeth, and the crowding of teeth occurs frequently in people with developmental disabilities. The teeth will not be able to perform vital functions if they are misaligned. Malocclusion is usually an inherited condition. This means it can be passed down from one generation to the next. There are some conditions or habits that may change the shape and structure of the jaw. These include cleft lip and palate, frequent use of a pacifier after the age of 3, prolonged use of bottle feeding, and thumb sucking in early childhood, tumors in the mouth or jaw, and abnormally shaped or impacted teeth. Muscle dysfunction contributes to malocclusion, particularly in people with cerebral palsy and Down syndrome. Teeth that are crowded or out of alignment are more difficult to keep clean, contributing to periodontal disease, dental caries, and tooth decay. Malocclusion can also cause problems related to oral function such as swallowing, speech, and discomfort when chewing or biting. These oral problems are often related to the difficulty of special needs children in performing adequate oral hygiene. To improve the oral health of individuals with special needs, it is essential for public oral healthcare services to incorporate intervention methods directed at the prevention and treatment of malocclusions. Next, children with special healthcare needs are at a greater risk of traumatic dental injuries due to unique predisposing factors. Most of these injuries happened at home and were caused by falls. There are many types of trauma that can occur, such as fracture and displaced tooth, enamel breakdown, erosion of enamel, and ulcers or swollen mouth. Traumatic dental injuries in special needs children have concentrated on individual types of medical diagnosis, such as children with intellectual disability, seizures, and abnormal protective reflexes, and poor muscle coordination like cerebral palsy. The injuries exhibit negative impact on them, such as the teeth that don't align properly. They have high tendency to develop speech problems. In addition to that, the malposition of teeth change the placement of tongue and allow excess air to pass between the teeth, creating a whistle when speaking. Furthermore, the trauma can affect their appearance. The children will have low confidence when they have no teeth. And lastly, trauma dental injuries affects their functional, aesthetics, psychological, and social problems. It initiates a series of socio-economic consequences affecting the quality of life, such as sleep disturbances and changes in daily schedule. The next subtopic in habits found in special needs children is food pouching. What exactly is food pouching? Pouching or pocketing food is when a child holds onto food in their mouth for a certain period, either in their cheeks, tucked behind, or in front of their gums before swallowing. We can see this habit in children who are not able to control facial muscles or have trouble swallowing and chewing, such as cerebral palsy patient and autistic children. There is a big reason why they have this habit. These children have the inability to coordinate facial muscles that makes them difficult to brush, rinse, floss, constrict drool, and clear food pouches in their mouth after a meal. The impact from the habit of food pouching are poor oral hygiene and tooth decay. Now, when we examine the mouth of the children, we can see food is seen scattered all over the child's mouth and never been swallowed. Due to long-term contact with food on tooth surface, bacteria will be harboring on the tooth surface and eventually causing tooth decay. Finally, parents can help their child by inspecting their child's mouth every time after they have finished eating. Parents can also make sure that their child rinse their mouth with water to clean the mouth from food debris. Lastly, sweeping the child's mouth with a finger wrapped in gauze can help to ensure the cleanliness of the child's mouth after eating. Other oral problems faced by special needs children is parafunctional habits. It is any behavior or functioning of the oral structures and associated muscles. For example, bruxism, teeth clenching, nail biting, lip biting, object biting, and thumb sucking. Bruxism is the grinding and clenching of teeth during sleep or awake. It is a normal occurrence in children with cerebral palsy due to poor coordination of the oral musculature. The effects are tooth wear, tooth fracture, and also headache. The treatment includes a stainless steel crown and a mouth guard. But extra care has to be taken due to the risk of aspiration. This slide shows a 7-year-old patient after the treatment with stainless steel crowns and mouth guard to treat his bruxism. He presented with a delayed eruption of his front teeth, and after 6 months of treatment, all of the teeth erupted normally. Here are the examples of tooth anomalies that may be presented by the children. First is hyperdontia, which is a condition where teeth are missing, either one or multiple. If all the teeth are missing, it is called anodontia. In contrast of that, we have supernumerary teeth, which can be in normal or abnormal size and shape. Supernumerary teeth can be frequently seen in cleft palate and lip cases. The next anomaly is microdontia, where the teeth are smaller in size than normal teeth depending on each individual. The teeth most commonly affected is the upper lateral incisor, which is called peg lateral because of its shape. The other type is macrodontia, which is the opposite of microdontia, in which the teeth are bigger than normal size. This condition usually is caused by hormone disturbances, for example, in the case of giantism. Next are the developmental defects of the teeth. These defects occur during developmental stages of the teeth before it enters the mouth and become visible. The most common defect is enamel hypoplasia. Enamel is the outermost layer of our teeth. In enamel hypoplasia, the enamel becomes thin or absent, which results in pits or grooves on the tooth surface. It appears as brown or yellow stains as seen in the picture. Other than that, another condition called as enamel opacity occurs due to hypomineralization of enamel. It appears as chalky white opacities, opposing the enamel's natural translucency. Both of these are risk conditions for dental caries and erosion in children. Finally, here are some tips to note for child care providers. Number 1, regular dental visits. Some may benefit more by visiting a special needs dentist rather than seeing a general dentist. Number 2, early dental visits. Evaluate and treat problems early to minimize risk of more complicated problems later in life. Number 3, help to brush their teeth. Children, particularly those with disabilities and special needs, may require further adult help. And number 4, specially shaped brushes, for example super brush, are available if child has a problem grasping on normal toothbrushes. Number 5, discourage sugar-filled foods and drinks. This should be avoided between meals to protect the child's teeth against cavities. Number 6, fluoride reduces cavities. Brush the teeth using a pea-sized dab of fluoridated toothpaste. Number 7, prevent baby bottle tooth decay. Don't leave a child sleeping with a bottle that contains anything but water. And number 8, floss their teeth. Help them floss using a slow and gentle sawing motion to prevent injury to the gum tissue. As mentioned just now, some may benefit more by visiting a special needs dentist. So, what exactly is a special needs dentist? They are involved in delivering oral health management and care for people with moderate to severe disabilities. They have been well trained in managing behavioral challenges, patients with complex medical problems, and cognitive impairment. Tender love and care are key elements to ensure patients are more comfortable and less frightened during dental visits. Now, what are the services provided? Number 1, consultation, dental examination and dental radiography, scaling, cleaning and hygiene services, restorative treatment, example fillings and crowns, root canal treatment, tooth extractions, dentures, as well as preventive therapy and advice. So right now we will end and wrap up today's presentation. Thank you so much for listening, and I hope somehow this presentation has been beneficial for you and your child. Have a lovely day ahead, and thank you once again.
That was a very interesting and elaborate presentation, don't you think? We all learned something new regarding special need care, ranging from habits, conditions that can be seen, and finally how we can reduce or prevent certain adverse conditions. It is important as caregivers to make sure our children receive good oral health care and proper oral hygiene instruction. Let's now open up the floor for some questions and invite back in our esteemed panel. So our first question for today is, my youngest child, 5-year-old, with Down syndrome has never been to a dental clinic. Is it possible to bring her to a regular dental clinic for a dental checkup? I'd like to direct this question to Dr. Kaur.
Yes, for the first visit, if the child's emotion is stable, she can be brought to a dental clinic. And what we should do there is the first very important thing is to avoid forcing the child to sit or to receive treatment. There's no forcing, and it's also let her settle down and be familiar with the clinic's environment, be familiar with the clinic staff. Okay. And we do have a dental clinic, as mentioned in the video just now, for special need children. And there are also experts who can help guiding the parents and the children all the way through the visit.
Okay, thank you very much, Dr. Kaur.
Okay, here is the other scenario. My child is 10 years old. When he was 7, he experienced high fever that caused him brain damage and affected his limb function. After going to physiotherapist for the past 2 years till now, he can barely move his limbs with limited movements, making him difficult to brush his teeth by his own. Is there any other way so that he can properly care for the teeth at home? Can Dr. Kaur again address us with these situations?
Okay. Well, depends on the condition. Normally, if the caregiver or the parents can actually help clean, and if we want to make the child more like can clean on his own, we can consider the powered toothbrush. Okay. Which require minimal skills. Okay, with the powered toothbrush. Yeah, that's one option that we can go for. Thank you.
Thank you, Doctor, for the sessions.
So this final question is for Dr. Cheng. My child's teeth appears like this since he was a baby. He felt apprehensive when talking to his friends due to its ugly appearance. Can it be treated to improve his appearance?
Yes. Yes. So actually for this, if the patient is very concerned about the aesthetic and meaning the appearance, right? Actually, this is a condition we call it as the enamel hyperplasia. So if the patient is very want to know more, want to improve his appearance or anything, actually teeth, what we can do is we can do a crown for the tooth, which will restore the tooth to its normal color and the shape. So for the maintenance of the healthy teeth conditions, we can actually apply fluorides by the dentist. So, and also we can also try to advise a good oral hygiene maintenance for the patient so they can always maintain themselves. So this is what we can do.
Thank you, Dr. Cheng. With this, we'd like to conclude the question round for this portion. We can move on to our next presentation.
You ever notice your teeth as if like they are dissolved? If yes, you will need to see this, and we are here to the rescue. Good day, everyone. Today we are going to present you the topic tooth erosion. So sit back, relax, and enjoy the talk. You might be wondering, what is actually tooth erosion? Based on the American Dental Association, tooth erosion is defined as the irreversible loss of dental hard tissue from acids, which it occurs without the involvement of the bacteria. According to the research done in Malaysia, they have found that the dental erosion occurs more in the male population as compared to female. This issue also commonly occurs among the children and adolescents, as nowadays young people tend to consume more of acidic drinks and foods. Looking to the aspect of teeth involvement, studies have found that overall worldwide prevalence of tooth erosion to be 30% in permanent teeth of children and adolescents aged 8 to 19 years. The most affected teeth will be the left and right posterior teeth, which are the back teeth, and the least one will be on the upper and lower anterior or the front teeth. Further research has shown that acidic foods and drinks are one of the most crucial factors in causing dental erosion. Next, why tooth erosion occurs? The factors causing dental erosion are classified into two main groups by its origin, which are the intrinsic causes and also the extrinsic causes. So let us look at them one by one. Firstly, the intrinsic causes. As the name suggests, intrinsic. So intrinsic erosions result from the frequent introduction of gastric acids into the oral cavity. The first intrinsic cause is gastroesophageal reflux disorder, which is also known as GERD. In people with GERD, the introduction of gastric acids into the oral cavity during sleep is very damaging to the teeth, as salivation and swallowing are reduced and the teeth will be bathed in the acids in the lying position, leading to dental erosion. The second intrinsic cause is bulimia. Bulimia nervosa is an eating disorder characterized by intentional vomiting to avoid gaining weight. The forceful expulsion of stomach acids onto the front teeth during vomiting will cause dental erosion. The third intrinsic cause is chronic alcoholism. It can cause dental erosion due to the frequent vomiting and increased regurgitation. The next intrinsic cause is pregnancy. There may be an increase in reflux due to the increase in intra-abdominal pressure during pregnancy, but dental erosion is rare unless the vomiting is chronic. On the other hand, extrinsic causes are the combination of dietary, lifestyle, environmental, and occupational factors that expose the teeth to acid causing dental erosion. The first extrinsic cause, which is the most significant, is diet. That includes excessive intake of acidic food and drinks such as soft drinks, fruit juice, and vinegar. The second extrinsic cause is the regular use of medication such as antihistamines and aspirin. Lastly, the industrial and occupational risk. The airborne industrial acids are implicated in dental erosion among factory workers, particularly in munitions, battery, and fertilizer. Swimmers frequenting poorly monitored chlorinated swimming pools have been reported to have increased levels of dental erosion, attributed to lowering of the water's pH balance. After all the etiologies mentioned before, we can know that the main factor causing tooth erosion is the acid, regardless of extrinsic or intrinsic origin. But how does the acid cause tooth erosion? Before we go into it, let us look at the normal structure of the tooth. As we all know, a normal tooth is composed of three components, which are the enamel, the dentine, and the pulp. The enamel, being the outer layer, is the hardest structure in our body that serves to protect the dentine and the pulp. The enamel is composed majority of minerals such as calcium phosphate, which makes the tooth enamel to be strong. Moving on, how does acid cause tooth erosion? Here's a fact. The critical pH of enamel is 5.5. What does this pH mean? It is the highest pH value of which there is a net loss of minerals from enamel. This indicates that when the pH value of our mouth is lower than 5.5, our mouth environment will become acidic, which leads to loss of minerals from the teeth known as demineralization, hence causing weakened enamel. On the other hand, when the pH value of our mouth is higher than 5.5, where the mouth environment is neutral or slightly alkaline, teeth will gain minerals and will make the teeth to be strong. And this is called remineralization. Thus, if our tooth enamel is exposed to substance that have a pH value of less than 5.5 for a long period of time, there will be constant loss of minerals and no longer have enough mineral to protect our tooth, leading to more dissolution of our tooth structure. Now, let us look at some signs of tooth erosion. The first clinical feature seen is cracked tooth surface. This happens because the acids will weaken the tooth enamel and cause the enamel to be more fragile and break easily. The next clinical feature seen is loss of tooth surface. Loss of tooth surface is seen because of the destruction by the acids that we usually consume from extrinsic sources such as carbonated drinks. Also, smooth and shiny appearance of the tooth will be observed. This is due to the loss of outer tooth surface and exposing more of the tooth structures below the tooth enamel, which makes the tooth more shiny. After that, the common clinical feature that can usually be seen is staining of the tooth. This is the same effect as drinking coffee, where the extrinsic tends to stay on the tooth. If the person do not brush their teeth or rinse their mouth immediately, the stains will always stay on the tooth surface. Then, there will also be flattening of the tooth and is a related factor that is seen from the loss of tooth surface from the acids, as I have mentioned in the previous explanations. Last but not least, sensitive tooth is also one of the clinical features of tooth erosion. This occurs because the underlying tissue structures are exposed directly to the outer environment that may induce a stimuli and response. To avoid any confusion, I would like you everyone to just have a quick understanding on the difference between the term tooth erosion and tooth wear. Many of you might have an idea and say that, oh, tooth erosion is the same as tooth wear, but no, that is not true. As we can see here, tooth erosion is the loss of dental hard tissue in the tooth, which is caused by acid. But please remember that the acid is not produced from the bacteria. The acid, however, may come from an intrinsic source or extrinsic sources, which causes destruction to the tooth, as we can see in this picture. In tooth wear, there is also loss of dental hard tissues in the teeth, but the wear is usually from trauma or acid produced by the bacteria, and it can be seen in this diagram. Next, tooth erosion has more destruction of the tooth when compared to tooth wear, where the destruction of tooth structure is only very minimal. Having said that, tooth wear is usually more localized to a particular region of the jaw only, and the common form of tooth wear is attrition, abrasion, and dental caries. In tooth erosion, it is usually more generalized in both upper and lower jaw, and it involves greater number of teeth as compared to tooth wear. So these are the basic ideas of the differences between tooth erosion and tooth wear. As we all know, if we leave something faulty untreated, it will lead to complications. There are several complications of dental erosion. The first complication is oversensitivity, where teeth respond quickly towards stimulus such as hot, cold, sweet, and sour. This happens because the outer layer of teeth, which is the enamel, has already worn or the root is exposed. The other complication is tooth fracture, where there is a break or crack in the hard shell of tooth. And depending on the type of fracture, the tooth may not cause any problems or it may cause pain. The third complication is tooth discoloration. Based on the picture given, when comparing with color of other teeth, you can see that the color is different. It does not look as bright or as white as it should. Then, the crystal that build up the tooth will erode slowly and cause complete loss of tooth structure. Besides that, The tooth can also turn clear and translucent, which indicates that the enamel is already worn out. Lastly, the rough edges on the teeth, where the teeth will become less smooth. This is because enamel starts to wear down. Prevention is always better than cure, at all times. So these are the precautions that we can take for avoiding dental erosion. We should avoid low pH substances as they provide more acidic environment, whereby we should lower the frequency of acidic and sweet foods and beverages uptake. Reduction of the frequency of consumption and the contact time of potentially erosive foods and drinks with the teeth are important, as well as the use of straws positioned toward the back of the mouth. In some patients with reduced salivary flow, they are advised to chew sugar-free gum after eating. This will help produce more saliva to help cancel out the acids which form in their mouth after eating. In the case of unhealthy lifestyles, the patient must be referred to a doctor for proper causal treatment. Also, immediately after vomiting, patients might be advised to rinse the mouth with water, milk, sodium bicarbonate solution, or preferably fluoride-containing mouth rinse. Next, fluoride toothpaste should be used. Fluoride acts as a remineralizing agent for the enamel. You can also apply fluoride gels or varnishes to the teeth. Lastly, workers exposed to acid or acidic fumes must use personal protective equipment such as respiratory mask. Coming to the treatment aspect of dental erosion, firstly, it includes the removal of any causative stimulus such as the acidic foods and drinks like lemon, soda drinks, and fruit juice. For the mild cases of dental erosion, topical fluoride is applied to promote the remineralization process of the outer enamel. Besides that, dental restoration is required in moderate cases to restore and cover the exposed enamel and dentin. In severe cases, root canal treatment is needed when the erosion has extended too much towards the pulp cavity and dental restoration cannot be done. Finally, the crowns and veneers. It helps to protect the dentin and enamel from the acids and also for the aesthetic purpose. In summary, dental erosion is one of the common types of tooth wear that affects a number of people worldwide, including Malaysians. Dental erosion is irreversible, hence why our focus of erosion intervention is prevention and reduction, followed by management. With the help of credible information and general knowledge, dental erosion caused by dietary habits is almost completely preventable. Let us be more informed on how dental erosion happens, how to avoid it, and subsequently how to have an overall better oral hygiene and health. On top of that, reduce the frequency of consumption of acidic drinks, most commonly carbonated drinks, and avoid soda switching when drinking these drinks. Most importantly, make sure to go for regular dental checkups so that any signs of early dental erosion can be screened earlier and your dentist can give the help that you might need. In conclusion, we must follow these 3 basic steps. Firstly, educate. We should educate ourselves on general dental hygiene and health and always seek information about this from credible sources and official websites. Second, avoid frequent intake of acidic drinks such as carbonated drinks, fruit juices, and wine. Third step is to encourage ourselves and the others to be disciplined in going to regular dental checkups, at least once in every 6 months. Together we can say goodbye to dental erosion. Thank you for your kind attention. We hope that this talk will benefit you and you have learned something from it. Once again, thank you very much. Take care, stay safe, keep calm, and protect our teeth. Goodbye.
Well presented. So the dental erosion is usually seen in the most cases, regardless of the age. Knowing the causes and trying to prevent the dental erosion is the ultimate treatment, I would say. So now let's take a few questions from the audience. Alright, so for the first questions, Dr. Cheng, I just keep wondering, can teeth repair itself from erosions without any treatment? Dr. Cheng, please.
So, okay, hi. Actually, when there's erosion, there's a damage to the tooth enamel, which is the outside layer of the tooth. The tooth enamel actually can be regrown. So, however, if you can prevent the erosion, what we can do is we can prevent the thing from getting worse, and with just a normal dental treatment, and by that we can take care of your tooth. Yeah, that's it.
Thank you, Dr. for enlightening us.
Dr. Ko, what is the difference between decay and erosion?
Okay, the main difference between caries and dental erosion are found in the acid. Okay, both are actually caused by acid. That the type of acid and where it comes from that differentiate both of them. Now, caries, also known as decay and cavities, is a process that begins with the demineralization of the tooth enamel. And this acid actually came from the bacteria. Sugary, starchy food turned into acid by bacteria in our mouth. Yeah? And the location that actually occurs in specific area of the teeth. Okay, and the result is the breakdown of the tooth enamel, causing cavity and decay to develop. And in early stage is normally reversible with remineralization, and when it's not reversible, to come to a stage where the cavity has occurred, we will can actually repair it with fillings. Yeah. And as for dental erosion, okay, it's a process that results in permanent damage caused by acids as well. But these acids may come from a different origin. Yeah, and the causes of the origin of the acids are, okay, one can be from the intrinsic from our body, like the stomach acid, and also it can come from extrinsic outside our body, like from the food, okay, drinks, and also as I mentioned in the slide earlier, for example, from the swimming pool, the water in the swimming pool. Yeah. So the location always occurs in the entire tooth surface, normally entire tooth surface, and the result is the weakening of the tooth structure, the enamel, causing this yellow and dull appearance, and also tooth sensitivity eventually. Yeah, and normally it's not reversible, and the treatment again may necessitate something like application and fluoride and so on, depending on the severity. Thank you.
Okay, thank you, Dr. Ko.
Okay, this is the most frequent asked questions. Dr. Cheng, are fruit juices better for teeth than soda?
Hi. Okay, yeah. Actually, this many patient, right? They actually tends to believe that actually fruit juice is more healthier than soda. So, but when we come to talking about the teeth and also our dental part, actually, it's not really so, because fruit juice like grape juice and also tomato juice, actually they are as acidic as the most soda, which is quite acidic from the pH of 2.5 to 3.5. So other than that, the type of acid that can erode your tooth also play a certain part of it. So in the fruit juice, what the common type of acid is the citric acid, which is quite common. And the citric acid actually is the worst offender for causing the erosion of the tooth. And also another thing is we always believe that fruit juice is made of fruits and it's always full of nutrient, but actually it's not. The fruit juice is essentially devoid of any nutrient when compared to the whole fruits. And also the sugar in the soft drinks and also the sugar in the fruit juice are actually basically the same. So you are actually drinking the same type of sugars and also quite a lot of amount of sugars in the fruit juice. So in the dental part, I would say that fruit juice and also the soda, both of them are not I mean like their fruit juice are not better than the sodas. Yeah, so they are like equally, yeah. Yeah, that's it. Thank you.
Okay, now I know. So then we would go for plain water lah then. Thank you, Doctor.
Since this question is related to the question number 3, let me ask Dr. Cheng to explain this. Can dental erosion be prevented if brushing is done immediately after consuming acidic food and drinks?
I think for these questions, most of them actually you can just search on internet. You can very obviously you can know the answer is that generally the dentists do not recommend it, to us to brush the teeth immediately after consuming any acidic food and drinks, because once we straight away go brush our tooth, if we taken the acidic foods, it can actually make the condition worse. The food that drinks that is acidic, such as what I explained just now, the fruit juice and also the soda, they can actually soften the outer layer of the tooth, which is the enamel, for a time. So when you brush too soon, you actually can damage the enamel while it's actually in a very weakened stage. So we recommend to wait an hour after consuming an acidic food before you brush your tooth to give your saliva a chance to harden the enamel naturally. Yeah, that's it.
Thank you, Doctor. For the last questions, I will address Dr. Cheng. Sorry, Dr. Ko. Sorry, my bad. Does tooth erosions involve one tooth only, or is involve all the teeth in the mouth? Dr. Ko. Yes.
Okay, tooth erosion we normally see affecting more than one teeth, and the destruction is more generalized for all teeth in the mouth instead of just in any particular individual tooth. Is usually very severe destruction of the tooth structure when involve the outer and inner structure of the tooth when compared to tooth wear. Now, tooth wear, on the other hand, involve normally the lower front teeth, which is more localized, and destruction is less severe as compared to tooth erosion. So less sensitivity involved when we compare it with tooth wear. So yeah. But these are all just in general, yeah. Okay. Sometimes we may see a more localized version of tooth erosion, okay. But most of the time it's more generalized.
All right. I would say that's it for the Q&A. So I would thanks both Dr. Cheng and Dr. Ko. It was such an honor to have you guys to be with us to answer all the questions just now. So now I shall proceed to the conclusions. All said and done, I really hope everyone can take the home message and try to implement them for our own betterment of life. Thanks for your 100% attention throughout this program. Have a nice day, have a nice weekend, and if anyone interested to do dental checkup, please give us a visit. See you when I see you. Stay safe.
We would also like to remind everyone to please click on the link provided in the chat box. It will direct you to a short quiz which can avail yourself to an e-voucher for our appreciation oral kit. This can be redeemed on visit to a MAHSA dental clinic. With this, I would like to conclude today's session. Thank you all for joining and have a great day.